But here I only have one bowl.
I've got more. I'll give you more. Let me just spray my hands again. Just give me a minute.
In my bag there is a linen
bought-
saver.
I
There's a
bought
linen
extra.
saver there in my bag, the blue one. Because there is no sterile paper, otherwise this sterile one.
This one?
Yes.
Yeah, it must be.
Dulcie, do you want this? I've got a sterile pack. I can give you more stuff.
Okay. Oh. So at any stage, if you feel that you have contaminated your hands, then you use the sanitizer.
On top of the glass.
You've forgotten something, you go and fetch, and then you use a a sanitizer. Where is it? I want to do it before I start.
Yes.
Here you go.
So I just want to talk to you all while we start.
It's a bigger size.
This is Sister
So
Dulcie.
this is sterile. Now I'm creating a sterile environment where I'm going to work from. You see, this part is sterile. Now what I do, I'll be using my syringe because I want to be closer to the patient, not to keep on moving away. And then again, the setup of your, wait, Sister Jane.
Okay.
The setup of your trolley, it must be a square like this. You are in between, your back must not face your trolley. So in other words, how to use it? You use it, move it using your elbow and your hand to come to any position that you like. Can you see? I do.
You want it closer?
There's another receiver there.
And there's a red bag.
Okay. The red bag, we use in that one. But before we do everything, we need to prepare our cream. I know the size of the wound. If you need a little bit of packing, because it's deeper, you don't want to put a layer on top without touching the bed of the patient. And then you use each cream for each patient. Can you see that I'm not touching the sterile part of the cream?
Can't see. Maybe come this side.
Surely.
So I think some of the gases come this side. It can.
Or you can use a wooden spatula.
Yeah, we don't speak to that. You don't need one.
Just use this one. Where is my
That's right.
Labana ka ufela ka
La bona kaofela.
Ke
la tshwanetse le bona.
Eh, bo le kgona ho bona.
So now I'm irrigating when I'm. Sorry, my dear.
Sorry.
It's cold. This solution is cold, you know. Then when cleaning, we're cleaning away, not
Oh, one.
directly onto the.
Oh, where
So you want to come around this way? Let me see.
Gloves are too big. Sorry.
Sorry. We'll be finished now.
How does this wound look like when you look at it? What can you see? Tell me what you can detect.
Ladies, talk. Describe the wound. Do you know anything about wound care? I don't think they've done wound care before, Sister Dulcie. We are the ones teaching them.
But when you look at it, if someone asks you, how is it, how does it look like? Not comparing it with the previous one, just looking at this one.
Septic.
Why do you say septic? What are the signs of
This
septic?
is a bone. It's a bone here.
No, we are far from the shape.
Ah,
So look at the color.
The color.
It must
Okay.
be pink. If it's not pink, can you see it's yellowish green?
Yeah.
So in other words, that is the dead tissue that you can see on this one. Because you need to be able to report to say how the wound looks like.
Yeah.
Okay, so now I'm going to apply this. And then I cannot just cover it, but I must make sure that it touches the inner part. So when I'm doing this, I call it the plugging. I want it
Plug
to
it in.
touch the inner. Sorry, my dear, is it so? You must tell me if it's painful, eh? I don't want to hurt you. Hmm?
He can't talk.
But are you okay?
So he's saying it's painful.
Painful? Okay, he's done. She's done now, right? 2 minutes.
This one goes to
Done.
the top. Then you remove excess fluid.
Wawona wena kam.
Otherwise, your dressing is not going to be well secured. Can you see that it's in? Just goes in. To make sure that it takes out that yellow stuff that you have seen. So when you are doing this dressing tomorrow, then you are able to see whether the sepsis is going away, it's now more pink, or it's still the same. The healing as well, the edges. So if it has got slough, it looks darkish black in colors. Crust, you feel like removing, but you can't because it needs debridement. You can't remove it directly. Otherwise, when you take it out, it may interfere with the blood vessel and the patient will start bleeding. Okay. Then after that, then I remove. It's supposed to be using this. Now where is the dressing that you'll be using? Is this the one? It looks too big. The dressing are very expensive. You want the smaller one?
I think just use it in the, you haven't got a scissors yet.
The small one is almost
Must I use this one?
Yeah.
What about the one that you left the last time? You did.
Have you
don't
got
have a
scissors
plug
there in
plus
the
there?
box, Mark?
Yes.
Okay, you can spray it first.
No,
Please.
go to my bag. There's a white box there. And then just give it to Sister Jenny to open it. Just don't put it on top.
So.
I've got a sterile scissor here that I can use. You said I must cut the dressing. Remember, I've covered the wound completely.
Yeah,
now.
but just hold it, we might need it again for the plaster.
Open here.
You see how she opens the side of the plaster? There should be two pieces that flip open. The same as I opened the dressing. You open where the two pieces open, and then you pull it apart, but you don't touch the inside. The inside has to stay sterile, like that, you see.
Oh, I'll use both. So yeah, I'm trying to improvise to make it fit. Where's the other one?
There's your
There's the piece.
The outer part of the dressing doesn't touch the trim. It's animating on. Here's the part that was supposed to use.
It actually works to cut it because then you can move it up.
And it goes according to the shape of the area that you're dressing.
Okay.
Is there any questions, ladies? Do you all understand how to do this?
Yes.
Okay, we have given you a form with instructions, but you're
So
welcome
the
to
wound
tell
is
us.
right, well covered. Now for extra, you can also use micropore
Yeah.
to cover it completely. Otherwise, you need to measure the size and everything and then make sure that it fits so well. So this one is a rectangle, it's not square.
Yeah.
So that's why I had to, just to cut to make sure that at least I bring all the edges together. So if we've got a micropore, then I
Micro,
can.
yeah.
Yeah.
Got micro-
If you go to one, because it's gonna come up.
You can cut that stuff that I bought. You can use my plaster now.
Yeah.
Sister Dulcie
That,
will cut
that
this.
works better.
Um,
The scissor.
You can use the non-sterile because it's close.
So what's the top now?
Where's the paper towel?
Here.
So use paper towel, it's wet.
Is it wet?
At all.
Just cut a very thin stripe here.
But the bed of the wound,
Yes, sister.
wound bed is well covered with the sterile. So these are just the edges. You remove it. Yeah, how does it work? Put this
Yeah.
one. Okay.
Like I told the other girls, do you see how we work as a team? It's very important for two of you to work together. Because it's hard to do this all alone, because you need someone to pass you something. You need another piece of another one.
Another piece for the other side.
Yeah, then it will be nice.
Nearly done, my dear.
It's better if you work together as a team. Then you've got somebody to pass you. If you forget to open the bottle, you can do that. It's much better if
But
you work
if you
together.
short staff, there's no one can just, as long as you have got your sanitize. When you feel that you have contaminated, you sanitize. But preferably if you want to be quick, faster, and professional, you work as a team.
Ladies, while you're here, I just want to introduce you to our Burn Foundation team. Sister Dulcie just did the demo. This is Kotsi. He's our logistics manager. Sean is our agroponics expert.
So when you see that the skin is emaciated, so as a result, when you remove it tomorrow, it might come up with the skin. So preferable. I'm sure you do have the alcohol soap. You can just use it to loosen up instead of pulling it out without.
Because it can get you
So it's done.
done.
And I'm just going to introduce you again to more.
And then after that, then throw away all your things. You set a bed. You put it underneath the trolley. Then take all the rest of the things. For this, I'm not going to throw them away because they can be reused for the same patient. Like for instance, is it a gauze tape? What is it?
It's a padding.
Or padding. So may use the padding maybe for him as well if there's a need. Don't throw it away. Remember, it's still clean as you didn't touch.
Maybe put the yellow one in the red one.
The yellow one in the red one.
Be careful, don't contaminate your hands.
And you don't touch the inner part of it. You throw the soil dressing without touching. Then we're done. The only thing we didn't do is to communicate with the patient every now and then. Because
Yeah.
our steps.
Yes, yes. No,
We are
I'm
showing
busy
him.
communicating.
Thank you very much for allowing us to do this dressing. It's going so well. It's
Are you
healing.
okay? Sure.
Okay, thank you. We'll
Thank
do
you.
it again tomorrow.
Thank you. Tomorrow we'll do it again.
Please do the dressing every single day. You can't miss even one day.
Huh? Are you okay?
Okay.